Jonathan, the federal government says they are supposed to be free. So why did a local man get charged hundreds of dollars for his COVID vaccine shots? He got them at a local urgent care clinic, but says he couldn't get an answer about a surprise bill. So we contacted the defenders with help with what appears to be a nationwide problem. It is tonight's defenders investigation.
She was very active early on in trying to secure vaccines for us and our immediate family.
Richard Garza's wife is a dentist. So in early January, she began the hunt for a vaccination appointment for herself.
I work directly in people's mouths and in aerosols and everything. So I feel like it's a little bit higher of a risk possible. Rick is exposed to me, and he does fall into 1B. So he's at a higher risk of getting severe COVID-19 illness. So I wanted to make sure that we got him vaccinated as soon as possible as well.
Dr. Garza got her appointment at a local hospital, but she booked Richard's appointment here, a Christus Prompt 2 urgent care located on Culebra Road on the far northwest side.
I was checking a lot of different places pretty regularly, and as soon as a spot opened up, I just put him in there.
On January 15th, Garza rolled up his sleeve and got his first jab of the Moderna vaccine.
They asked me which arm I wanted the shot in, and it was very quick. And before I knew it, I was just waiting in the observation time period, and then I left.
Garza returned to the same location on February 12th for his second shot.
So that's all they did. You went there, you got the shot in the arm and waited, and you were done.
Yes, sir. Yep.
The Garzas were now fully vaccinated and thought that was the end of the process. But 15 days after getting that second shot, they got a surprise in the mail.
I just kind of turned to him and I was like, "We got a bill for your COVID vaccine." And of course, I was really surprised because I knew it was supposed to be free.
What is the total bill that you have been given?
The total bill was $394.39.
The invoice didn't even specify what they were being billed for. It only listed medical services, $183 for the first visit and $211.39 for the second. Dr. Garza contacted the company's billing department to point out what she believed was a mistake.
But they didn't, acknowledge any error on their part.
When their insurance provider refused to cover the charges, the Garzas filed an appeal, but it was denied.
And all that they said was after review, they were upholding their decision to keep the charges for the urgent care visit.
The problem? According to the Centers for Disease Control and Prevention, vaccination providers cannot charge you for the vaccine or charge you directly for any administration fees, co-pays, or co-insurance. They can seek reimbursement from your insurance provider for a vaccine administration fee, but they cannot charge you the balance of the bill. In other words, you should pay nothing for the vaccine.
I feel like the entire thing was an error, and that they just kind of need to make sure that they're in compliance with the rules for vaccination providers.
And according to the Inspector General of the U.S. Department of Health and Human Services, it's not just happening here in Texas. The OIG is aware of complaints by patients about these charges by providers, adding that those who charge the impermissible fees must refund the money and stop charging the fees. So what happened here? We reached out to representatives for Christus Health and asked for an interview, which they declined. But on the same day they were contacted by the defenders, Christus informed the Garzas they no longer owed anything.
I don't think it's a coincidence.
She was very forthcoming and apologetic and was like, this was first and foremost a billing error. And, now we are doing everything we can to clear your account.
In a statement to the defenders, Christus Health said, "We are deeply sorry for the error and the inconvenience it caused, and will always work to ensure that the same happens for everyone who visits one of our facilities."
There's really no telling, how many people did it happen to? And are they going to resolve it, when those people reach out, or are they actually looking into it on their own?
The Garzas hope Christus Health sticks to its word and fixes any other errors that may have occurred. But they also worry about the effect mistakes like this could have on people's decision to get vaccinated.
My big fear is that if people hear that they might be charged or billed, that they're just not going to get the vaccine, which is the worst case scenario. Right. We don't need any further barriers for people to getting the vaccine.
And again, as we mentioned, these vaccines are supposed to be free of charge to anyone who wants one. You should not be billed. If you did get a bill like the Garzas, we'd like to hear from you, and so would the federal government. Look for this story online to find out how you can file a complaint against a provider with the U.S. Department of Health and Human Services Office of Inspector General. And you can share your stories with us by sending an email to defenders@ksat.com.